Hello, everyone. My name is Vani Fonseca, and I will be presenting on telehealth. In just the first 3 months of the COVID-19 pandemic, telehealth visits in the United States rose by over 766%. That is not just a spike, but rather healthcare innovation at its finest. For many people, a doctor's appointment consists of waiting a long time just to be seen for about 10 minutes. It's inconvenient, inefficient, and in some cases, unsafe. This issue was then exacerbated during the height of COVID-19 pandemic. But from that challenge, one of the most transformative healthcare innovations came to be: telehealth. Today, I'd like to inform you about the rise of telehealth technologies as a direct result of the COVID-19 pandemic, how it changed the way we access care, why it's not just a temporary solution, but a lasting shift towards a more accessible, efficient, and equitable healthcare system. Between 2019 and 2021, telehealth usage skyrocketed. Visits increased from 15% to 86%. And like I said, within that first 3 months, how telehealth encounters increased by 766%, showing that it's not just a trend, but a turning point. Now, the question is why? Why was there such a huge adoption of this innovation? Well, it's because telehealth removes barriers. Think about patients who are disabled, live in rural areas, lack reliable transportation, or immunocompromised. Telehealth lets them receive care from the safety and comfort of their home, which is not just convenient, but life-changing, especially for those with chronic illnesses. It also saves so much time. Studies show that on average, wait times are just 1.8 days for phone visits and 2.3 days for video visits compared to the 3.5 days for in-person appointments, which means that quicker care will happen, which leads to earlier diagnosis and better outcomes. Also, it goes beyond routine checkups. Today, telehealth is used for primary care and prescription refills, mental health services like teletherapy and crisis support, chronic disease management, post-op and specialty care. Ultimately, it helps reduce system strain and lowers costs for both patients and providers. Another powerful aspect of telehealth is remote patient monitoring. These are digital health devices that collect real-time data for patients and transmit it to healthcare teams. A few examples are blood pressure cuffs, continuous glucose monitoring, pulse oximeters, smart inhalers, and general wearable devices. Using these tools, providers can monitor patients between visits, adjust treatment plans, and intervene before conditions worsen, all without patients stepping foot in the clinic. Of course, none of this would have been possible without policy changes. During COVID, Medicare expanded coverage in telehealth, and many insurers passed parity laws requiring virtual visits to be reimbursed at the same rate as in-person ones. This is critical because financial access and healthcare access go hand in hand. When telehealth is reimbursed fairly, more providers offer it and more patients benefit. As we look forward, telehealth is no longer just an emergency response. It's a cornerstone of modern care. It offers convenience, continuity, and compassion in a way traditional healthcare often struggle to provide. Thank you for listening.